that was crushing and debilitating, and now we have to reverse all that in their mid-40s. So, again, if you're a parent, or if you have family members who are getting ready to have children, you want to share this information with them, because it's very, very important that they start it off right. So let's talk a little bit about another topic that relates to this, and that is cesarean section. Now, I know that cesareans can sometimes be a medical emergency, and if that's the case, you've got to do what's right to save the baby's life, to save the mom's life. Completely understandable. But let's talk about some of the risks associated with cesarean, so that if you find yourself in that situation, there are some things that can be done that can help the baby. One of the problems with cesarean that we're finding, there's a number of research studies that have validated this, is that babies born by cesarean, their gut flora, their microbiome is colonized by the hospital air. And that's hospital air. Remember, what's it full of? It's full of bacteria that are resistant to antibiotics. So like methicillin-resistant staph and things like MARCoNS and multiple antibiotic-resistant coagulase-negative staph aureus. These are major types of infections that we don't want our baby's GI tracts to be colonized with when we're born, right? And so cesarean, where does a baby get their healthy bacteria? Aside from being in the womb is not sterile, by the way. There's bacteria in the blood. There's bacteria that get passed from mom to baby. But that big colonization occurs during birth through the vaginal canal. The baby's mouth is open and being populated by all the vaginal bacteria. So the mom's healthy vaginal bacteria are what are going to populate the baby's microbiome when the baby's first born. But with cesarean, we don't get that. We get the population occurring through hospital air or through environmental exposure in the hospital. So that can be a major problem, because the wrong type of bacteria at birth can predispose a baby to lifelong allergies, to asthma, to autoimmune diseases like type 1 diabetes. So there's all these different medical conditions that have now been linked to the improper colonization of the microbiome at birth. So cesarean is fine and good if there's an emergency situation, but oftentimes we see parents today, again, going back to my rant earlier, now going into being a parent, the time to be selfish, you've got to step back and ask what's the best for your child. And cesarean is not the best if you have a choice. Choosing cesarean because you want to have a scheduled delivery on a certain day is a horrible choice. You should always opt for that delivery when the baby's ready to come. And I see this, a lot of doctors want to get those cesarean scheduled, or want to assume a cesarean is necessary, or are doing unnecessary cesarean. So you want to stand your ground there, and you want to make sure that you do everything you can within your power. I mean, unforeseen, again, an emergency type of event where that's not something that you do, because your baby needs that vaginal flora to populate its gut and be healthy. Now, what a new practice is happening, if you do have a cesarean, there's this new practice called vaginal swathing, which is where you take some towels and you soak up the vaginal fluids and you bathe the baby's face in those fluids and around the mouth, so that bacteria from the mother's vagina can populate the baby, even though that baby might have come through cesarean section. So again, that's a practice that's becoming more and more popular, and I would recommend that you look into it. Again, if you're getting ready to have a baby and an emergency cesarean has to happen, this is an option for you, for that baby to be much healthier. One of the other things that happens during the cesarean or right after is that the mom will get carted off to a recovery room. And as they're in that recovery room, of course, the baby gets taken to the nursery. And if dad's there and dad's around, the baby will be with dad, but in that nursery. But one of the things that a lot of nurses like to do, and this is not me saying anything bad about nursing or about nurses. So if you're a nurse, don't take offense to this. This is truth sticks. And if you can't handle truth sticks, go away. But a lot of nurses will want to put sugar water in your baby's mouth. If mom's off resting, the common thought in a hospital is the baby's going to go hypoglycemic. The blood sugar is going to drop and it's going to hurt the baby unless we put sugar water in his mouth right away. And so that's what they try to do. If you allow that, then your baby's first food is actually going to be genetically modified sugar water with glyphosate in it, not something that you want. So you've got to, as a parent, you've got to talk to the OB-GYN, you've got to talk to the doctors who are on staff in that hospital who are going to be making sure that they're taking care of you if you're delivering in a hospital, that those types of things don't happen. So you got to get with your husband, and you guys have to have a contingency plan should a cesarean happen, we don't want sugar water in our baby's mouth. We don't necessarily want all that antibiotic rubbed all over our baby's face. And we want to avoid a cesarean if even if at all possible. Now, I strongly encourage working with a doula or a midwife, but also having access to a hospital should an emergency happen. So the best of both worlds would be working with a midwife or a doula, in my opinion, where you can try a natural delivery. And I know a lot of women are saying, what does this guy think he is? He doesn't know the pain that's involved with the delivery. How dare he even comment on the topic? Look, the reality is that humans have been having babies without drugs for 100,000 years plus, and hospitals have only been around for about 60 years. And again, a hospital can be important in saving a life if an emergency situation comes up. But let's not do more intervention than what's necessary that could potentially harm your child for the rest of their life, creating the stage or setting the stage for an autoimmune disease or setting the stage for some type of major problem. So anyway, I think it's important that any new mom understands those things, because as they move forward into the role of becoming a parent, being selfless needs to become the forefront of your thought process. Additionally, let's talk about some food introductions. This is one of the biggest questions I get from my new mothers is, how do I introduce food to the child? What's the proper order? When, at what month, at what age? And there's some things to keep in mind. Kidney and liver development are not going to occur super early. So we don't super early. When I say super early, we need at least a good solid 6 months before those two organs are fully developed, where the baby is able to really start digesting certain types of foods. So my advice is no real food introduction until around the age of 6 months. And at that point, we really want to introduce only pureed vegetables. We don't want to introduce certainly no grain. We certainly don't want to introduce a bunch of fruit first, because we want to accommodate, we want the baby's taste buds to start accommodating vegetables first. And so introducing a variety like squashes and other forms of vegetables to the baby around 6 months. Always introduce only one food at a time. And when you're introducing that first food, let a few weeks go by. What we're looking for is we're looking for any symptoms or signs of allergic response. Now, an acute allergy is going to happen fast. You're going to see hives. You're going to see potential diaper rashes coming through the poop. If the baby, sometimes we'll see a major diaper rash that won't go away because the baby's getting something or getting exposed to something that he or she's allergic to. And sometimes we'll see really fussy, really colicky babies when food is introduced. And those, again, that's what we're looking for. We're looking for outbreak of skin rash, diaper rash. We're looking for colic. We're looking for excessive gas. Just paying attention to the baby's response and happiness when we're introducing a food. And I always introduce one food and give it a couple of weeks before you try to introduce the next. We're not in any huge rush in essence to introduce them, but always start with vegetables before working your way into the fruits, because again, we want to establish that the baby will actually eat some things as opposed to just being bombarded with sugar from the get-go. And as long as you're breastfeeding, remember the nourishment, the vitamin C and the essential fatty acids and the zinc and the iron and the chromium and the B vitamins are all going to come through breast milk. So remember, introduction of food is more of a supplementary as we're introducing these foods and making sure our babies can digest them appropriately. So vegetables first. Come around month 9, you can start trying to introduce some of the fruits and actually some very, very small quantities of some of the pureed meats. And so it's always best to introduce them one at a time, wait a few weeks, and introduce one thing at a time so that you can observe for any types of abnormal changes in behavior or illnesses. Additionally, there are certain foods we don't want to introduce at least until after 12 months. The first one, and I don't really recommend that it's really ever introduced, is cow's milk. A lot of parents, they fall victim or prey to those commercials, got milk commercials, right? It's one of the most successful marketing campaigns that's ever been put together. But milk is not a human necessity. Cow's milk is not a human necessity. Human babies do not require cow's milk for nourishment or for strong bones. And so cow's milk is highly allergenic. It's one of the top 8 allergens in the world. Corn is one of the top 8. Actually, it's not in the top 8. It's more like in the top 10. But we've got, most of your grains are in that list. And then beyond that, we don't want to introduce orange or tomato. We don't want to introduce fish, especially shellfish. We don't want to introduce dairy. We don't want to introduce egg until the baby is at least 12 months of age. So those are the big ones you want to wait on. Don't introduce those sooner. Wait at least till 12 months so that the baby's immune system has a little bit of time on the development side. Now, we don't have time in this session to get into vaccinations. I know that may be another question that's kind of on the back of a lot of your minds. I will say this just briefly. I don't think any baby should be vaccinated before the age of 2 if vaccinated at all, because their immune systems haven't developed. And all of the injuries I've ever seen in children happened with multiple dose vaccines before the age of 2. I mean, this is where we see it. And oftentimes, because I see this on a regular basis with patients, it's the day after they were given 3 or 4 or 6 different shots or vaccines. So I don't recommend any until after 2. And even then I recommend, if you're going to do it, and this is your decision to make, as it is for every parent, but if you're going to do it, if it's something that you believe that you want to do, I recommend a scattered schedule. And there are a number. There's a reference I would recommend that you check out. One, you can go check out The Truth About Vaccines, which was a documentary series just put on. You can also go check out the work of Dr. Sherry Tenpenny. My advice would be just get educated on the potential side effects and get informed consent. Know what the risks are, know what the dangers are on both sides before you make that decision. But I don't recommend anything before the age of 2 because the baby's immune system hasn't developed well enough to really be able to handle the immune burden that's going to be injected. And remember, a lot of vaccines, one of the main ingredients is egg. And just what did I just say? I said, don't introduce egg in the first 12 months of life because the likelihood for a reaction that can be quite devastating and quite dangerous is much higher. Okay,